Thank you very much for the invitation, and it's really nice to be here to talk about a topic that's pretty dear to me as far as taking care of athletes with concussions. I've been doing this for about 20 years now at various college levels and high school levels, and also was active duty in the military for 13 years in the Army, and then joined the Air National Guard over here at Pease a few years ago. Certainly in the military, saw a variety of concussions, not only sports-related, took care of Special Forces guys, airborne operations, but of course the blast injuries that we saw in Iraq as well. Now those are certainly different than what you guys will be seeing here in Dover, New Hampshire. Hopefully we'll never see anything like that. And so this is a topic that I think everybody here can relate to. Just out of curiosity, and you can be honest as far as how many people here in the audience, to your definition of what this is, because we're going to talk about this, in your mind have sustained or had at least one concussion. Wow. Okay, good. All right. Not good, but good that you're forward about it. Okay. Well, we're going to talk about this a little bit because there are a lot of misconceptions about what a concussion is, what it's not, how to get you guys back to return to play, and just realize that as a sports medicine guy, our goal is to get you back to play as soon as possible, but we want to get you back to play safely, okay? And we don't want you to be out there at risk for another concussion or another injury, so it's very, very important that we're smart about returning to play, returning to school when it comes to a concussion. So what I'm going to do, I'm going to start off with just a good case, a representation of a concussion, and we're going to act as if this is an athlete who had a concussion and then is going to be showing up in my office, like a lot of you all, asking questions about this concussion. What is it not, and when can I return to play? Okay, so this is a 16-year-old football player at a football game, basically goes to catch a ball, gets, quote, flattened by the defensive player. You know, everybody's all jacked up, big play, the kid's on the ground. After about 5 minutes being on the ground, did not lose consciousness, was able to answer questions appropriately, and after about 20 minutes back on the sideline, after he's been seen by the athletic trainer, he says, I feel real good, I want to go back in. Well, the athletic trainer says, no, absolutely not. But the athletic trainer gets busy taking care of another athlete. Coach says, hey, you okay, can you go back in? And the kid's like, yeah, I feel pretty good. So he goes back in, the athletic trainer doesn't see him go back in, and after about 2 plays, he pulls himself back out with a really bad headache, nauseous, feeling dizzy, etc. So the next day, the parents in the office, like I said, I've been doing this for about 20 years, seen all kinds of concussions over the years, and this is a classic case. The parents will come in with one of you guys and say, hey, the game last night, Matt got lit up pretty hard on this one particular play. And so I'm going to show you guys this video because Dad happened to be taking a video watching his son. So I'll just watch one more time. Okay, so parents are in the office, and I ask you guys, was this a concussion? Did he sustain a concussion? Yeah, who says yes? Okay. Who says, no, I don't think so. Just got his bell rung, okay? Well, that's a big problem, is because a lot of folks, and you guys didn't raise your hands on this, think that getting your bell rung is not a concussion. You just got your bell rung. And for those of us that played, years ago, we used to get our bell rung, now and then. You shake it off, you felt okay, you go back in and you do okay. And there's sometimes you'd have a headache for a day or two, and sometimes the headache would be gone by the end of the night. But getting your bell rung, where you get hit so hard that you go, wow, that was quite a hit. And then you feel dizzy, a little foggy, a little groggy. That's a concussion. The real technical definition is kind of hard to understand, but basically it's when you sustain a blow that's hard enough that makes you have an alteration in your mental function and your neurologic function, where basically you get hit so hard you're stunned, and it may be just very, very quickly, and you may not have symptoms right away. The symptoms may come on hours or even the next day. So that's what makes it kind of hard. You take a hit, it was a hard hit, you got hit, and you're like, wow, that was a hard hit. But you don't have a lot of symptoms right away, but then later that night or the next morning you have symptoms: headache, dizzy, confused, etc. So there's no doubt that Matt had a concussion. Should he have gone back in the game? Should he ever go back in the game? Or practice? No. The answer is he should not have gone back. Now, I understand why he did. He felt good. He felt fine. He didn't have a headache anymore. And I remember from doing this for 20 years, at high school and college level, it was very common for an athlete to get his bell rung, get dinged, usually with not any amnesia, but sometimes for a minute they felt like they didn't remember anything. And we would watch them for 20 minutes, 30 minutes or so, do serial exams on them, and then have them run, sprint, push-ups, jumping jacks. And how do you feel? I feel great, feel great. And you look in their eyes, and they look totally clear. They don't have that foggy look. They look terrific, no problems. And we'd say, you feel great. You passed all the tests. Your balance was okay. And it said, hey, I really have no reason to not put you back in. And they'd go back in, and most of them, to our knowledge, would do absolutely fine. However, we found over the years that that's really not a good idea. Your brain function is not right for sometimes several weeks, sometimes months. Usual concussion, people are better in about 7 to 14 days, but not always, and we'll talk about that a little bit. The parents said they woke them up every 2 hours to check on them. Okay, you guys have probably heard that a lot in the past. Get a concussion, you should wake somebody up, check on them. Is that a good idea? Not necessary, okay? That's overkill. We used to think that. But the reality is what they're looking for when people have a concussion or a head injury is for any significant swelling in the brain or bleeding in the brain. That is so uncommon, not never, but it's so uncommon in sports, not a car accident, not a fall, but in sports injuries that's so uncommon that's really, it's less than 2% ever need any sort of neurosurgical intervention. So it's very, very rare. In other words, let these guys sleep. You guys should be getting your sleep. You're not going to go into a deep coma, all right? What you need is you need to let your brain rest and get a good night's sleep, and you should do fine. So waking up every 2 hours is really not advised or necessary in a sports concussion. So, Matt's not feeling too good in the office. He's got some mild nausea. He's been vomiting. But not prolonged vomiting. He's had a couple episodes of vomiting, but it's not like he's vomiting constantly. He just had a couple episodes. Lightheaded, feels a little foggy, vision feels a little bit off. He didn't sleep well, because he kept getting woken up every 2 hours, he didn't sleep well. And he remembers everything now, for sure. He doesn't have any memory deficit at all. We examine him. He's alert. He answers all his questions. He has this sort of look, though, right, kind of looking off in the distance. When you ask him questions, he's really sort of kind of spacey, right? Doesn't feel great. But otherwise, his exam, all the things that we do, finger to nose and balance, this BES test is a balance test where they close your eyes like this, and if you start going like that, we take points off. We add up the different points. We don't get too complicated with this. Basically, 2 or 3 sort of errors when you fall out is normal, but if someone just kept going like this and can't keep their balance, that's concerning that there may be something serious going on. He didn't have that. He was okay. He was okay as far as his balance. Had a few errors, but it wasn't terrible. So nothing that made me think there was something seriously going on inside his brain, like a bleed or swelling in his brain. So Dad says, he doesn't look like. Look at that stare in his eyes. Doesn't he need a CAT scan? Why aren't we getting a CAT scan on him? Okay, well, for the reason we mentioned before. These type of things are so rare, bleeding in the brain or significant swelling in the brain, that everybody to get a CAT scan after a concussion is really it's overkill. And let's face it, CAT scan is a fair amount of radiation. And there's, if you have a 14-year-old that gets a CAT scan, there's a good chance that later in your lifetime you're going to get a lot more CAT scans. Maybe your brain again, maybe your abdomen for coming in for some other abdominal, who knows if you're going to get a CAT scan over your lifetime. And a CAT scan's a fair amount of radiation. So really the recommendations are that it shouldn't be reflex, you get a concussion, that you get a CAT scan of your head. That should not be the reflex that you should be thinking. Now, if, however, something's going on where, for example, really unsteady, like this person can't walk in a straight line, That's concerning. That would necessitate a CAT scan. That's really not normal for a concussion. Worsening headache. The headache is just intensifying. It's not getting any better, it's getting worse, especially if they say it's the worst headache they've ever had. Taking Tylenol, it's not getting better, it's getting worse, more intensifying. That's a concern, that's a red flag. That should go to the emergency room and get a CAT scan. Prolonged vomiting. Can't stop. Keeps getting the dry heaves, throwing up to the point, just won't stop. That could be a sign that there's pressure building in the brain, and this person can't stop throwing up because of the pressure, and that's causing this reflex where they're throwing up. So is it uncommon, or is it common for people to throw up after a concussion? Yes. And 2-3 times? Yeah, that's not uncommon for kids to have a concussion and throw up a couple of times. But if it's not stopping, just keep heaving and heaving and heaving, that's not a good sign. Changing mental status, meaning everybody says he is acting or she's acting really weird. This is not right. And it's changing. They're getting more sleepy, or they're getting more aggressive, or just not acting right. And some of the guidelines will say, if you have loss of consciousness greater than a minute, and a minute, when you're down on the field and you're out for a minute, that's a long time. But there are some that certainly advocate that if you have loss of consciousness greater than a minute, probably a serious enough blow that should have a CAT scan. If I can watch the athlete closely over the next 12 hours, then I'm not going to necessarily get a CAT scan in that case. But if I don't have that ability, or the parents say, this is really worrying us, and he was out for over a minute, yeah, it's okay to get a CAT scan in that regard. Okay, so when can Matt return to football? I think he had a grade 2 concussion. I've read my guidelines, the parents were saying, and he's going to be out for about a week or two, right? Well, we don't do it that way anymore. That's not the way we take care of concussions. That's old school. And I was telling a group a couple weeks ago, we had a UNH women's hockey player that transferred from another school. She wanted to play hockey at UNH. She had like 3 concussions at this other major university, and they said, listen, third one took you almost 6 months to get better. You are done here. We're not letting you play hockey here anymore. You've had too many concussions, and the last one took you 6 months to get better. Bottom line is she went up to Detroit, where she was from, and had this high-powered neurologist, and he cleared her. And I was reading a note, this was only a couple of years ago, he basically said, well, per the Colorado concussion guidelines, she can go back and play. Well, we haven't used the Colorado concussion guidelines for about 10 years. So this high-powered neurologist that she got to clear her was not even up to date on how we manage concussions anymore. So we basically said, this means nothing to us. This neurologist does not practice current sports concussion care. I'm not accepting that. So bottom line is, what we do is that we rest you. You have to rest. Physically, take it easy. Doesn't mean you can't go for a walk, but you shouldn't be out there jumping, running, sprinting. You really got to let your body rest. The more sleep you get, the better, okay? We also got to rest your brain. We call it cognitive rest. And when you guys come to see me for concussions, I will write a note for school. I shouldn't tell you this because, not that you're going to try to get out of tests and things, but the reality is we will recommend to the school and the teachers that, listen, so-and-so just had a concussion. It's going to take a little while to clear. We've got to back down on the homework. Got to have, if you have to take a quiz, extra time, open book, open notes, what have you, to kind of help you out. Maybe you shouldn't be taking a test at all. Let's do the bare bones minimum academically to not let you get too far behind, if possible, and then we'll start to advance you as you can. So we got to rest your brain, and that means text messaging, video gaming, loud concerts, loud football games, loud basketball games. All of that is not great for a brain that's trying to recover from a concussion. So you get bright lights, loud noises. Those of you who had concussions, which are most of the audience, know that a lot of those things will make you feel lousy once you've had a concussion. You got to let that settle down, okay? There's been a lot of talk about these online tests, these neurocognitive tests like IMPACT, CogSport, a lot of these things. These are a tool, all right? These are a tool to help us return athletes back to play. They are not the savior, okay? There's been a lot of push, everybody's got to get one, everybody's got one. Well, that's not the current guidance. As a matter of fact, a lot of the current guidelines are cautiously like, yes, if you can get it, a baseline neurocognitive test where you're doing reaction time and matching colors and symbols and that type of thing, like Impact, which is a University of Pittsburgh product. That's great, and it does help us, but it's not the final decision maker. So if you get a concussion and you have a baseline test, once your symptoms are cleared, we'll test you again and look at your numbers to see how you did. And if you're back to your baseline or pretty darn close, we'll start advancing you to get returned back to play. If you don't have the impact test or something like it, again, it's not like, oh no, this can't happen. Again, it's just a tool. It is not the final decision maker, and there's a lot of debate about when you should start. Because if you start in junior high school with impact testing, they're going to have to probably get another baseline test pretty much every year. Because that brain in that age group is developing so quickly that their baseline that you get in 6th grade is probably going to be different than 7th grade and 8th grade. So you're going to have to do it every single year. In high school, what we usually recommend would be get it your freshman year and get one your junior year. And then when you get into college, you're going to get another one if you play at the college level. Okay? So it's a lot of debate. It's not clear-cut whether it's a great idea. It's not even clear-cut whether it makes a difference in the long run on how we manage concussions. But is it a nice tool? Yes. Does it help us? Yes. But is it the final decision maker on whether you return to play? Absolutely not. It's just a tool. How do we know when he's ready to return? Well, that's part of it. We have you guys have to be honest. Okay? The biggest thing for athletes is you guys have to be honest about your symptoms. If you're not feeling well, don't tell us you're feeling well, because you're only hurting yourself. If you go back and play too soon and you get another collision or contact, or even if you don't, i.e. you just get your body whipped and your head does this, and your symptoms come back, now something that might have only taken a week or two to get better may now take a month or 2 or 3 months to get better. So you're really not doing yourself any favors if you go back too soon, because there's a very good chance that you could get another concussion that will set you back even longer. There's definitely a window after a concussion where you're more susceptible. So, for example, you get a concussion, you're out for a week or 2, we gradually get you back. In other words, you're symptom-free for 24 hours. Then, if you have an impact test, great. If you don't, we start to do light activity first. Like the first day, you might do a stationary bike or elliptical trainer for 20 minutes or so. That's it. All right? Done for that day. The next day, you might do some running. That goes well. The next day, you do running and some sprinting, maybe some jumping jacks, maybe some push-ups. If you feel great, no problems, no symptoms that night, no symptoms that day. The next thing would be is to get you into a non-contact, non-collision practice. All right, doing drills, wearing a yellow jersey, if you will. No one hits you, no one touches you. If that goes well, then we'll try to get you back into contact. This is, again, to protect you. We do have folks that feel great at rest. They feel great with a light jog. They go out and start to sprint. They don't feel so good. They get nauseous, they get a headache, they get light sensitive, they feel foggy, they can't concentrate. All those symptoms come roaring back. We have to take a little bit of a break and step back again. Okay? So we got to be very careful how quickly we do that. But in about a 30-day window at least, once you have a concussion, you're more susceptible for sure to another one. Okay? So even though you feel great and you look great and you pass all the tests, definitely in the 30-day, maybe even 90-day window, you're definitely much more susceptible to another concussion than if you never had one before. And certainly, the more concussions you have, the more likely you are to have another one. Now, we don't know how big that is. In other words, you have one concussion this time, you get a second one. Does the risk go up like that? Not in everybody. No, there are some players, some athletes that's probably true, but there's other athletes that get 3, 5, 6, 8 concussions, and it may be over 8, 10, 12 years, and they do fine. We don't really understand why that is. Some people do better than others, and some people don't. Returning to school, would you be so kind of like come on up, and we're going to talk a little bit about, because returning back to academics and schoolwork and a full academic load, and how to help you guys get through school, because we get a lot of people who get very stressed out when they start falling behind academically, and that just makes things worse as far as your recovery, right? It just makes it harder for you to get better if you're worried that you're going to start failing classes. I think one of the big things we have to learn is that, we hear people say a lot, oh, it's just a minor concussion or a mild concussion, and I really think that we got to get away from that terminology, because quite honestly, you never know what's going to be a mild concussion and not until it's over. So what might have seemed like just a minor blow, and for one athlete may not be a minor blow for another athlete, meaning the symptoms may go on for a long time, or a lot of difficulty concentrating, focusing, not sleeping well, getting depressed, getting angry. We've had athletes come off the field and after about a half hour or so start to be kind of uncontrollably giggling and laughing. Like, what's that all about? Why are you laughing? It's because emotionally they become very unstable from their concussion. So the reality is there's really no such thing. It's a head injury, all right, and there's no such thing as a mild concussion. There really isn't, because it could last symptoms for a long time, just one concussion. Now, this isn't here to scare you about concussions, because they happen in all sports, and we're going to talk about that a little bit as well, but we have to recognize that they can be potentially a problem that can last for a long time, and we have to take them seriously. Okay. We talked about rest, we talked about the video games, the text messaging. Reading, I'll usually say, read for 20, 25 minutes, take a 5-minute break, put your head down, close your eyes, get some rest, and go ahead, if you can, go back and do some more reading. But take frequent breaks. Don't be trying to cram, 2 or 3 hours of solid reading or computer time in, because you're going to have symptoms. It's going to make you feel terrible, okay? We talked about the note, sleep, hydration, and basically just manage your symptoms. You have a headache, we help you with your headache. Start feeling like you can't focus or concentrate, we potentially get some rehab involved to help you with some tools on how you can focus better. So we basically have to just take our time and let you guys take your time to recover from this. And it's very unpredictable. I always tell athletes this: there's no way to predict. I don't have a crystal ball. I can't tell you how long it's going to take. Just know that I'm on your side. I want to get you back as soon as you can, safely, but there's no way, there's no test, there's no blood test that I can do that's going to tell you you're going to be back next week or the week after, the week after. All right? We definitely know that a blow to the head that causes a rotational spin on the head, and especially if you come off the field and you're real dizzy or lightheaded, those concussions tend to take longer to get better than the direct blow to the head where you get up and like, ooh, I kind of got stunned. Those typically do better, okay? The ones where you get off and you're really unsteady on your feet and you're doing one of these, you can't focus, honestly, most of those take longer to get better from. Okay, you can't prevent them all. Here's a big thing. You're going to have folks that are going to try to sell you helmets. They're going to try to sell you fancy little headbands and equipment like that say, I can prevent this concussion. Here's the reality. We'll never be able to prevent all concussions. We just won't, okay? The reason being is not all concussions are caused by a direct blow to the head. Some of them are just caused by a forceful whipping of the body. So if someone gets a body check in any sport, whether it's hockey, soccer, football, whatever the case may be, and the body gets whipped where the head snaps back, well, the brain sort of sloshes in your skull, if you will. It's an oversimplification. But what's a helmet going to do about that? The head never hit the ground. The head never hit another player's knee or elbow or the floor or anything. Basically, it just got whipped so hard that the brain did this and caused a concussion. So you can put a band around your head, okay? You can put a helmet on, but that's not going to do anything for those concussions. And I'll be honest with you, there's a fair number of those concussions that happen that way and aren't direct blows to the head. So in sports and non-sports. So don't let anybody wow you with a fancy helmet. Now, are there helmets in football that have been shown to be a little bit more protective? Virginia Tech did a study a couple of years ago. They rate some helmets 5-star, 4-star, 3-star. That's more of a concussive impact and lessening the impact. For those, read that at Virginia Tech. You can do helmet study. You can Google it. It'll show you some of the helmets that maybe aren't as protective and others that are. But the study's now a couple of years old and new helmets are coming out. But remember, you don't have to go buy $1 million helmet and think you're going to prevent all concussions. Not all concussions are caused by a direct blow to the head. All right? So could it be helpful? You don't want the low budget helmet? True. But they're not designed for concussions as much as they were for skull fractures. The new helmets are trying to be designed more for concussive blows to sort of deflect blows, etc. But if your head gets spun around or it gets just side deflected and your brain spins, you're going to get a concussion, very likely. And the helmet didn't do anything about that. So yes, helmets are important, but they're not going to, but there's no one piece of equipment that's going to, no mouth guards. Mouth guards don't do it, okay? Neck strengthening. Yes, it can be helpful. At least Dr. Cantu in Boston, he's a friend of mine. He's a phenomenal guy with research in concussion care. He's a strong believer that it's by strengthening your neck muscles, especially for those whipping type injuries, where if your neck can slow your head down nice and progressively, your brain's not going to do this because your neck muscles activate and slow your brain down and slow your head down. So you're not getting that snap because your muscles are so strong, they react so quickly, they can slow things down. And so neck strengthening exercise, especially for someone who's had a lot of, more than one concussion, but anybody, neck strengthening is a good idea. Omega-3 fatty acids, like in fish oil, there's some evidence that say that may be protective, and it may also be helping recovery. All right, it's a little soft in the medical literature on that, but there's some evidence that it's growing that say, hey, maybe. Now, how much? How many fish oil capsules do you have to take to get enough omega-3 fatty acids in you? Well, that's what mostly is in fish oil, salmon oil. We don't know that magic number. Is it a whole bottle of fish oil, or is it just 3 or 4? We don't know that yet. We're still learning. Okay, so like we talked about, Matt's feeling better now. We're going to gradually get him back to play day by day. We really work with the athletic trainers, your athletic trainers, to make sure that their symptoms are gone, and one day at a time, progress activity level. Non-contact initially, light jogging, sprinting, and then gradually getting up to full contact. But it can take a while. So really don't think that once your symptoms are gone, the next day you're full contact in whatever sport you're in. We can't do it that way. You have to gradually get back to play to be safe. Some of the things we know about and we don't know about. How many are too many? And parents ask me that all the time. We don't know how many is too many concussions, because there are athletes that can take 100 concussions and never have a problem. And there are some that have 2 or 3 and they're just never quite the same again. And it's a lot of factors involved that some we understand, some we don't. Some genetics potentially. What I usually tell parents is this. One concussion you're going to have, that's not uncommon. If you're having concussions that are coming frequently, if you're getting a concussion every season, whatever sport you're in, and or it's taking longer and longer to get better. So for example, you get one concussion, your symptoms go away in a week or so, you feel pretty good, get back to play in about almost 2 weeks by the time everything's said and done. And then the next season you get another concussion. Now this one takes you 4 weeks to get better. Before your symptoms go away, you can focus and concentrate, you're back to normal. It's kind of a bad sign, okay? 2 years later, you just happen to get another concussion. You're you're just hanging around skateboarding or something, you trip up, hit your head. 2 years later, and now this one takes you 4 months to get better. Bad sign, all right? Each concussion you're getting is taking you longer and longer to recover from. That's when you really got to have the conversation about, is it really worth this particular sport? Where you clearly have had 2 or 3 or 4 or 5, whatever, but they're getting harder to get better from, and your symptoms are becoming more severe potentially as well. So there's no magic number. Everybody's individualized. It really depends on how you're feeling and how long it takes you to get back and how severe your symptoms are. But we'll give you some guidance. We'll do our best. I had one girl who came to me. She was 14. She's had 12 concussions. Mostly field hockey and lacrosse. 12. And still doing. I'm like, why? And the mom and dad are like, well, she loves it. Loves the game. Yeah, but the last one took her 6 months to get better from. She's already had 12. She's only 14. And those are the ones that she knew about. And I never saw them again. After I told them, I said, you should not be doing these activities. It's very clear that this is a problem. And they didn't want to hear that. Okay. Any sport, okay? Football gets all the press. Football is a high-contact collision sport. It gets a lot of press. You can't ignore the other sports. You can't necessarily say that a high school player who's going to be done by Thanksgiving of his senior year and never ever play again is going to turn out like an NFL football player who there's an association but not a causation. In other words, there's certainly an association with multiple concussions in NFL players with the depression, the suicide, the cognitive deficits. They haven't proved it causes it. There's an association. And you can't really compare an NFL football player who's taken multiple hits and subconcussive hits over several years. High-level college, high-level NFL. It doesn't mean your kid's going to turn out like an NFL football player after his Thanksgiving of his senior year. You can't, apples to oranges, it's not the same thing. And there are other sports that concussions. I can tell you, I had my sheet here with Dover High School. There were a lot of concussions in other sports here at Dover High School over the last couple of years. A lot in hockey, a fair number in girls soccer, boys and girls lacrosse. Same as football? No, not far behind. Not far behind. Okay, a couple of videos, and I'll try to get one last video in if I can. just to show you, obviously, this is very, you guys.
Running a small business is hard.
Got to get through the commercial, apparently. Skip ad.
Caught him right under the chin. Very similar to the hit he put on player the other night. And that's scary right there. Because he had no idea that crowd.
How often does this happen? You never see that. I mean, you guys don't know when this happens out in real life, right? This stuff happens not uncommonly on the playground, if you will. Skiing. Okay? Skiers and snowboarders get that all the time. Not all the time, but frequently. All right? It's a non-contact, non-collision sport. Skiing and snowboarding are sports. This happens a lot in those other sports. And what about gymnastics and cheerleading? You see a lot of concussions, a lot in gymnastics in this. Okay. The point is here, guys, there's a lot of sports that get concussions. Okay, a lot of sports. A lot of ones you think might not, including gymnastics, synchronized swimming, right? 50% you said of the synchronized swimmers in the Olympics have had concussions from getting kicked in the head or elbowed in the head or whatever. Who would think synchronized swimming, you're going to get, there's a high concussion rate. It's a high concussion. It's just not a real popular sport. It doesn't have the total numbers because it's just, you don't see a lot of synchronized swimmers, but they get it. Okay. So I'm going to go through basically here real quickly, and then we'll watch the video for as much as we can. Again, remember, concussions are real. It's a head injury. There's no such thing as a minor concussion. You just have no idea how long it's going to take to get better. There's no more grading schemes. There's no grade 1, no grade 2, no grade 3 concussion. And I'll be honest with you, it's hard even for me, and this is my subspecialty, concussion care, to keep up with all the latest and greatest on the guidelines. But a lot of you guys will go to your primary care docs, and I'm a primary care doc. And I'll be honest with you, you got to be careful that they don't say, okay, you're out for a week and then go back to full contact. Or go out for 2 weeks and you should be okay, just go out and try it. It's not the right answer. It's not how we do things now. And so if you're getting that answer, you should question that. Because you get out to grade 2 concussion, you should be good in 2 weeks. It's not how we handle it. And it's not to bash your primary care doctors at all, because I am one. It's just that these are things you have to keep up on. It's very important, especially with a head injury, that you're on top of the latest guidelines on how to take care of it, because that's not how we do it anymore. Don't lie about your symptoms, and the same day, for sure, you should never return to play or practice. And if you see one of your teammates that gets dinged and not looking right, you got to speak up and talk to your athletic trainer. Don't just walk away and like, he'll be okay, or start laughing at him. I've seen tell us, hey man, you look pretty funny. You all right? You okay? And they're not okay, and you're just letting them do their thing, and that's not safe. That's not a good idea. We see it all the time. If in doubt, take it out. Just sit it out, rest, be patient, and over time this is going to get better. All right, you're going to get better. Just got to be careful and be safe about gradually returning to school and returning back to sports. So I'm going to show you as much of this video as I can. Peter, I will try not to go too late. I think we got about 5-6 minutes, but this is a nice report, actually. It really hits the message home about concussions.
We're going to get back into our story tonight about head injuries in girls soccer. Again, second only to football in the number of reported concussions. As we've seen, these concussions can have terrible, long-lasting consequences. As Kate Snow now continues her report, she asks the parents of female players where they draw the line.
For these soccer families in suburban Philadelphia, every weekend is the same drill.
How much of your social lives were built around soccer?
Almost all of it.
It
goes
camps
all
too.
year round.
Some places football's big. Well, soccer's huge here.
This is hardcore.
Oh, it is hardcore.
It was very.
Do you ever think you made soccer too important?
I think that we were blind to what was going on around us because, yes, it was about the team, it was about the winning.
While they were out there winning, something disturbing was happening. One by one, year by year, their daughters were all suffering concussions, an alarming number of them for one small group of friends.
I've had 3 concussions.
I've had 2.
I've had 3.
I think I've had like 7 or 8.
And the damage from those head injuries is not only physical, but psychological too.
How many of you have been on antidepressants?
When Hannah Thomas couldn't play soccer for months after her concussion, she lost hope. And what she revealed in our interview is hard for any parent to hear.
I didn't even want to have to live. It was really hard.
You didn't want to live.
It was really hard.
What does that mean, Hannah? Does that mean that you actually thought about taking your life? You make me cry.
I just didn't know how I was going to live through the rest of what I was going through. It was just so much put on you to have to deal with socially and mentally. Everything just piled in, and it was so hard to deal with.
I see you crying too, Casey. Why?
Because I just feel what she's going through. It's happened to me as well.
You felt the same way?
Just sitting in your room knowing that you can't do anything. And it's just rough. You can't even connect with your friends through text or call them because you can't look at your phone because it hurts so bad.
The tough decision as a family is it's either risk your brain or be socially miserable with no identity. That's a tough choice.
Sports psychologist Richard Ginsburg says the growing enthusiasm for soccer from parents and coaches may actually be making matters worse.
We get wrapped up. We want success for them. And so sometimes we lose perspective. It doesn't make us terrible people. It just makes us human.
Over the years, I got so involved with it, it really became something that we shared.
Jim Thomas started coaching his daughter Hannah's team when she was just 5. He's excited she's recovered from her injuries and has just been cleared by a doctor to play again.
It was like a whole new horizon out there that we were going to get a chance to get back in and be able to rejoin an activity that was such a big part of our lives prior to the concussion.
Interesting that you're using we.
Mm-hmm.
So it's both of you?
Yes, absolutely.
I'm a soccer mom. I have 2 kids who play soccer. I love the game of soccer, but it's a game.
It is a game.
And at some point you wonder whether you have to say to a kid, this is just a game, it's not worth your health.
I've said that. I've asked her if she agrees with the statement. She says, yes, it is just a game. But Dad, I think I can do it. And Dad, I really want to do it.
She said that she got so depressed that at one point she actually thought about taking her own life. So now that she's recovered, why take the risk that she could end up in a dark place like that again?
I keep going back to the same answer, and it's hard to imagine that you would get there again. I'm not overly concerned about that. But the thought doesn't escape me.
Of our group, Casey Biddle is the only other one still playing. But after 2 concussions, she says she's avoiding headers.
I use my chest more now.
But you can't totally avoid it.
If it's a small kick, you can head it. And if you head it right, it won't hurt. But if you head it wrong, it kills.
The number 1 symptom is just a blank stare.
Casey's parents, Mike and Angie Biddle, remember her first concussion and admit they're tense watching her games now.
You're watching her play and you see a ball coming her way. We do take a little bit of a deep breath and hope that she doesn't get hurt.
The night before our big group interview, she'd played in a game and took a hit to the head.
I got hit in the head again, and that's just hard, taking it.
Were you hitting the ball?
No, it just
hit you.
Hit me, yep.
How are you feeling?
I have a really bad headache right now, so I don't know.
She had told me that she had a mild headache. She said it wasn't that bad.
After telling her mom that, we filmed Casey scoring 2 goals in back-to-back games. But the next day, her headache became unbearable. It turns out that hit 4 days earlier caused a concussion.
You told your mom you had a little bit of a headache.
Yeah.
But you didn't think it was related to the hit.
Yeah, I didn't think that it was.
Or did you think maybe it was, but you didn't want to scare your mom?
A little bit of both.
And also maybe not wanting to accept it yourself.
Yeah. I didn't want to be hurt again.
I did have some suspicions, and I wish I had gone more with my gut. I wanted to trust the fact that she knew she was okay.
Best case scenario, I would take heading out of soccer under the ages of 14.
Altogether.
I'd take it out, yes.
Dr. Bob Cantu, a neurosurgeon and leading researcher, says eliminating heading would dramatically reduce the number of concussions in youth soccer.
More than 50% of concussions are occurring in the act of heading the ball. And what's actually happening is the young ladies collide heads as well as elbows, shoulders. So it's other body part hitting the head as well as head to head in the act of heading.
Soccer purists are not going to like that.
No, they're not going to like it at all, and they're going to argue that you need to teach the skills of the sport.
Yeah, I move my feet.
Soccer champion Brandy Chastain helped the U.S. women's team win the World Cup.
Why not just ban headers?
Because it's a part of the game. And I think it's an important part, and I think it's a beautiful part of the game.
She says girls need to be taught to create protective space around their bodies.
Not exposing my head to the space first.
She says heading isn't dangerous if it's done correctly.
Okay, good. Arms are out. You hit it right in the middle of that sweet spot, right above your eyebrows, in the middle of your forehead, like that. You almost don't feel it.
Casey says she knows where that sweet spot is, but with this latest concussion, she didn't see the ball coming, and now she's out of soccer for the rest of the season.
Where is the line where you cross over and say it's not worth it anymore,
Well,
it's just a game?
I think that our family is standing on that line right now, and it's very scary from a parent looking at your daughter with a concussion, and when you see the blank stare, and if it can happen again, you know, we want our daughter back.
Now Casey's parents say they're going to convince their daughter to give up soccer for good and switch to a non-contact sport like track.
She is just my sunshine. She lights up the room when she walks in the room. And that's the light that you want to see every day. You don't want to see the blank stare.
As for Hannah Thomas, she's getting ready to try out for another travel soccer team.
I really want to play. Like, it's not that I don't want to, it's just scary.
You don't have to, right? Nobody's forcing you, or is...
I want to, though. That's the problem.
Anna, ball.
But her dad says he'll be watching her closely.
We're at the point where if she does have another head injury, that soccer's over.
That's it?
That's it.
So one more concussion.
One more concussion,
and she's out.
And she's not going to play.
Kate Snow here with us in the studio. She should probably point out we're all in this together. I mean, my daughter's former high school captain of her team. And this was every weekend of our lives, and you'll be there this weekend.
2 kids playing soccer. My husband played through college. He's a coach. We are huge soccer fans, soccer family. We're not down on soccer. None of the people we talk to are down on soccer. They're just saying, let's be smart about it. If you see anything. I mean, you heard the girls say, Brian, they don't necessarily tell you how they're feeling. Right. They don't necessarily lie to themselves, and they lie to their coaches and their parents. So if something looks wrong, like that mother said, my gut was telling me something was wrong, take the kid out of the game, wait it out. It's better to be safe than sorry. And the other thing these girls did is they played through concussions, which meant that then, once you've had one, if you get hit again, you can do remarkable damage, life-altering damage to yourself with subsequent concussions.
By the way,
So I think, guys, this isn't to scare you, and it's not to pick on soccer by any stretch of the imagination, but those take-home messages are really important. Listen to your symptoms if you get a concussion. Parents, be aware that if you think that your child may have had a concussion, be aware of that. Be looking for the signs, the personality changes, the being withdrawn, the headache, the focusing issues. As you can see, it can happen in any sport. And we get that you guys, athletes, you want to get back and play. But remember, it can be a serious problem if you try to play through those symptoms. If you do it smart, you get your rest, academically get your rest, physically get your rest. There's an excellent chance you're going to recover from this, and that's going to be in. These girls had multiple concussions, and you can see that many of them, if not all of them, tried to play through their symptoms, and they got in trouble. This really hurt them in the long run. So try not to do that. I know you guys want to play. I know parents, you want your kids to play, but it is a game. You're going to need your brain for the rest of your life. Prevention-wise, do your neck strengthening, proper technique. We have coaches. You got to buy into concussions are real. Okay? We need officials be able to watch out and call it. It'd be nice to be able to empower officials that if an official sees something that looks like a concussion, that they stop play, grab the coach, grab the athletic trainer and said, I saw that kid get rocked pretty hard in whatever sport. I want you to take a look at this kid. I think that something may have happened to him. So it'd be nice if we can empower our officials to be able to do that. Coaches, if you see something that doesn't look right, you saw a pretty big blow or a hit or a side swipe, and you see something that that looked kind of bad, get your athlete off the field, have them checked out, don't take a chance, okay? Don't take a chance on that. Have them checked out. And if you're in doubt, like we've used that mantra before, just sit them out. Just let them rest, call it. There'll always be another game, okay? And don't take the chance. But the nice thing is we all love sports, whether it's a collision sport or a non-collision, skiing, whatever. It's fun. We enjoy it. There's great benefits in sports. Don't take away your sports because there's risk in everything we do. You can get an ACL tear. You can blow out your shoulder. Be smart about it. Train properly. Use the right technique. Don't be a dirty player. And really, be honest about how you feel if you get a concussion. Okay? We got to get out of the room. But what I'm going to do, I'm going to step outside in the hallway. I'll stay as long as you guys want me to stay to answer any of your questions, okay? So thanks for the opportunity, and have a great night.